With flu season coming to a close and allergy season ramping up, we understand many of you may be experiencing symptoms similar to COVID-19. So what do you do if you think you're sick? I sat down with our experts to learn more.
If I want a coronavirus test, how do I get one?
So testing has been very difficult. There's been very limited supply in terms of test kits and laboratory capacity for that. The laboratory capacity is increasing relatively rapidly, but the shortage of testing materials, the kits that we use to get a sample and get it to the lab are becoming short supply as well. Turnaround time on laboratory results has been difficult. Initially, commercial labs were giving guidance that they would turn around a test in maybe 3 to 5 days after they received it, but we know from experience that that's not accurate, and so there's a possibility that you could get a sample collected and may not get a result for a long enough time that you have already recovered, and the result doesn't mean anything in terms of decision making.
When should I get tested?
When should you get tested? There's a lot of concern out there, both in the media as well as the public in general about being tested. I think there's a lot of fear of the unknown. And the reality is we do have tests that are available. It's been frustrating to a lot of people because it's not as readily available as, say, a flu test or a rapid strep, which most people are familiar with. Initially, the COVID-19 test was only available through the CDC. That spread to many of the state labs, and now they're becoming more commercially available through LabCorp and Quest and others that are national labs. The problem is there's really not enough supply of the testing kits themselves, as well as capacity of these major labs to handle the volume of the influx of all the testing that's being done. If you would not ordinarily have sought help for a medical attention such as the flu, then there's really no reason to run just to get tested to see if you have it or not.
So I had a test, but I'm waiting on results. Why does it take so long?
A lot of people are wondering why it takes so long to get their test results back. And the reason for that simply is just the demand on the system. And so the number of tests that are being done now and sent out to the national labs are just simply taking a long time to process, to come back. I expect that's going to improve over the near future once more laboratories are able to test at a more local level. So as for now, just be patient as we're working through this. We were initially told 3 to 5 days. We're finding out now that's 5 to 7 days and sometimes even longer to receive the labs back.
For additional information about COVID-19, visit nortonhealthcare.com/COVID.